Thompson.
Thank you, Dame Eleanor. It's always a pleasure to serve under your chairmanship. And can I begin by thanking honourable colleagues for the contributions they've made, the petitioners for obviously raising this petition in the first place, and especially, as others have done, the Honourable Lady from Newcastle North on the work of her committee in bringing this issue to us today. I think that as an issue where we can't underestimate the impact it has on so many people, and it was really encouraging to see so many sharing their experiences in record numbers with the inquiry. There can be few issues more important to society than how we look after the health and well-being of pregnant women and new parents and newborn children. So it is great to see the matter prioritised on the first day back here in Westminster Hall. It is a great pity that the UK Government's response to the recommendation so far has been more of a shrug of our shoulders than a helping hand, and I very much hope that the Minister is here today with a renewed vigour for action, simply saying that we have the best or amongst the best and most generous systems in the world won't really cut it, and will those struggling financially. And while maternity allowances are far from generous, and UNICEF ranks the UK amongst the least family-friendly of the world's richest countries, and it's a worrying thought that, unbound by EU minimums, that perhaps we may see that under threat. The Government response so far to this report suggests that they have either not grasped or are not concerned about the extent of Covid-19 on the lives and livelihoods of pregnant women and new parents, and it should be an easy decision, really, to extend maternity leave by 3 months at the very least, to make sure those who have unfairly lost income, lost leave rights, lost access to health and dentistry service, to baby groups, to family and childcare support are not disadvantaged even further. I think it's safe to say that the Prime Minister is in a beneficial position of undoubtedly being able to enjoy the benefits of having a newborn baby around through this period. I mean, it certainly brings so much joy in a period of difficulty. However, it would be difficult to argue that he would be able to perhaps share the experience with those who are struggling with poverty, low wages, insecure work, loss of access to healthcare support, to those facing discriminatory attitudes from an employer. We've heard from other members those who've seen their roles downgraded on return. In a survey of almost 20,000 mothers and pregnant women by the campaign group Pregnant and Screwed, 46% of those being made redundant blamed a lack of childcare provision due to the Covid-19 pandemic. And there are thousands of real experience summarised in the committee report, which will hopefully persuade the Minister of the need for a more sympathetic response as we look to move forward. So far, the Government has been sluggish in responding to the recommendations in the report, waiting until September before even coming out to say no to most of them. We know that they can rush to react when they want to. They didn't, for example, drag their heels in any shape or form when it came to getting rid of procurement rules, so they could splash billions of public money on questionable contracts to private companies of their choosing, regardless of evidence of ability to carry out the job. But when it comes to the relatively small and inexpensive fixes that would ensure fairness for pregnant women and new parents, it's a far slower response. Measures like making sure guidance for employers and employees is clear would stop people struggling unnecessarily to save on the need for costly, time-consuming tribunals. On the 16th of March, the Government announced that pregnant women at work were especially vulnerable, but they did nothing to make clear the legal obligations under existing health and safety rules that if alternative safe work or work from home could not be provided, then they should be able to be suspended on full pay. Instead, many women were wrongly forced into sick pay, unpaid leave, or forced to use up their holiday entitlement or start their maternity leave early. For many, this affected their entitlement to statutory maternity pay and reduced their maternity leave when they needed it most. The Government could have prevented this, but they chose to leave these things in a murky mess, which will allow pregnant women rights to be ignored with impunity. Unsurprisingly, when asked how many employees the Health and Safety Executive have investigated and taken enforcement action against for breaching obligations to pregnant women since March, the answer was none. This pandemic has been a wake-up call for so many, and an opportunity, I think, where we could have seen the Government respond to the very detailed inquiry that was undertaken by the Petitions Committee. And I'll finish with this, Madam Chair. On the 8th of April, the Chancellor said, "When you need it, when you fall in hard times, we'll be there for you." Well, I urge the Government today, even at this late stage, to prove actions and not words that are there